How common is infertility?
So I talk about this a lot. I will say sometimes, women will have that experience where they want to have a baby and boom, get pregnant right away, which obviously is great and emotionally doesn't take the same toll that having difficulty does. It's normal, when we pull off all sorts of birth control, whether that's condoms, birth control pills, IUD, when we stop everything and we're trying to get pregnant, it's normal for that process to take up to a year. Usually from a physician standpoint, if you haven't, achieved and gotten pregnant on your own within a 1 year period, that's really worthy of a conversation about, okay, let's look at this a little bit closer and let's try to figure out maybe why that didn't happen. Upwards of 85-90% of couples will get pregnant on their own within that 1 year, range. So certainly things could still be normal and maybe a couple just needed a little bit more time. And so that's possible. But once we hit that 1 year mark, we really prefer to look a little bit closer to see maybe what the issue could be. There's some basic testing that we do. Most of our testing is geared towards our female patients as gynecologists. This is the one time that we look a little bit closer at the male partners.
It's good for them to be looked at.
It is good for them to be looked at. Yeah, we do a lot of workup with ours, but obviously, to create a baby, you need both the people. So from a male perspective, we usually do a semen analysis or look at the sperm a little bit more closely to make sure that, those parameters are all okay. It's a really helpful test because it gives us, the count, how they're moving. There's some really helpful information and a very easy basic test to get that wealth of information from. It's really important if you're having, struggles that you've been tracking your period. So they make a lot of free apps that are great, free. You can mark down when you have a period if you're not having a period. Another important part about getting pregnant is the ability to ovulate or to know if you're ovulating, which means your ovaries are releasing an egg that has the ability to be fertilized. So they do make over-the-counter ovulation predictor kits that all women can readily buy if they want to track that a little bit closer. And so you can also write that down in your electronic phone or tracker if that's happening. And then we look a little bit closely too to make sure that the fallopian tubes are open. And that's a test called an HSG. But there's some reasons women may have issues, whether it's pelvic infections, could be endometriosis. There's reasons why we might suspect that there could be a blockage in a fallopian tube. And so even if we know our sperm is okay and we know we're ovulating, if those two things can't meet because of an issue with the tube, then that test gives us some information. So certainly there could be more to that, labs, different ultrasounds, but those are a lot of the basic things we look at if we hit that 1 year mark to look a little bit closer into it.